Hello everyone and welcome. Thank you for joining us for this session in our Immersive Education webinar series, From VR to OR, using 3D Organon as a pre-lab learning tool for surgical simulation labs in undergraduate anatomy. My name is Jenna Marioglu and I'm part of the customer development team at 3D Organon. We're delighted to have you with us today. We are joined by our speaker, Jenna Kuczek, a PhD student and graduate teaching associate in the Department of Biomedical Education and Anatomy at The Ohio State University College of Medicine. In today's session, Jenna will explore how immersive technologies are transforming anatomy education and helping bridge the gap between classroom learning and practical and clinical practice. Jenna brings extensive experience in undergraduate and graduate anatomy instruction, including musculoskeletal and clinical anatomy, as well as innovative work in virtual reality and simulated surgical training environments. Her PhD research focuses on developing and implementing a clinical anatomy course for undergraduate students, integrating immersive VR environments and simulation-based surgical training. She has also developed the Advanced Musculoskeletal Anatomy course at OSU and has presented her work at this year's American Association for Anatomy conference. Her contributions have been recognized with multiple awards, including the Sam Drogo Technology in the Classroom Award, the John Martin Second Timers Award, and the Graduate Associate Teaching Award, among others. Jenna, welcome. We're very happy to have you with us today.
Thank you. Let me just share my screen. And are you seeing that in full screen there?
Yes.
Great. Okay, well, welcome everyone. I just wanted to start by saying thank you to 3D Organon for having me here today. I'm very excited to share some of my work with everyone. So I would like to take you from the VR into the OR as I walk you through how I used 3D Organon as a pre-lab learning tool for surgical simulation labs in undergraduate anatomy at Ohio State. So kind of our outline for today, I wanted to introduce myself a little bit more, intro you to my clinical anatomy course where I implemented these VR and surgery labs. I wanted to walk you through the actual lab activities, and then I want to walk you through my research study design and some results. And then I'm going to jump back to 3D Organon's technology and kind of give some demos and the pros and cons. I would like to talk about some capabilities I really appreciated as an instructor myself. I'm going to share some student feedback, move into some challenges faced and how you can fix those issues, some considerations and practical advice if you would like to implement this technology into your own course, my future work, and then leave some time for questions. All right, so a little bit about me. I got my bachelor's of science degree at Ohio State in biology and pre-medicine. And then I moved to Chicago where I completed 2 years of medical school at Rosalind Franklin University. I kind of got to my third year of medical school and decided I liked teaching medicine more than practicing it. So I ended up leaving Rosalind Franklin and coming back to The Ohio State again to get my master's degree in anatomy. And now I'm currently working on my PhD in anatomy, and I'm almost done. I have about a year left. While at Ohio State, I've been a graduate teaching associate for about 4 years now. And some courses I teach include, or sorry, some populations I teach include undergraduates, physical therapy, occupational therapy, and medical students. And some of those courses I do teach here include gross anatomy, dissection-based anatomy, clinical anatomy, and musculoskeletal anatomy, with those latter two being courses I've actually created and implemented here at Ohio State for our anatomy minor degree program. And then some of the research areas I've been working on include course development with these two courses I spoke on, virtual reality and the surgery simulations that I'll be talking about today. I've jumped into some high school outreach research. We're starting up a project right now on the musculoskeletal anatomy course. And lastly, game-based learning. So I included a publication here, actually my first publication that we did in November 2025, using a board game for review in really large-scale anatomy courses at Ohio State. And then I just wanted to touch on some awards I've received and some presentations I've given really related to this specific project I'm going to share with you today. So at the Human Anatomy and Physiology Society Conference in 2025, I received the Sam Drogo Technology in the Classroom Award for my innovative use of technology within the classroom. And there's just a picture from the award ceremony. And there I got to give my first kind of conference presentation on my use of virtual reality in the simulated surgeries in undergrad anatomy. And then this year, in April 2026, I was chosen to give an oral presentation on this project at the Anatomy Connected conference through the American Association of Anatomy. And there's me at the podium. It was a lot of fun and a great learning experience. Moving forward, in May of 2026 this year, I received another award at the Human Anatomy and Physiology Society conference called the John Martin Second Timers Award. And then I got to present a poster on this same project as well. And then lastly, through the Ohio State University Division of Anatomy, I won the George Martin Research Scholarship, again, for this research work and my contributions to anatomical sciences education. And lastly, something I'm most proud of, this year I won the Graduate Associate Teaching Award through the Ohio State Graduate School. And this is open to about 3,000 graduate TAs through the university. And this was a student-nominated award. So I really take pride in this award, and I always really just am working for the students. So moving forward, some of my teaching principles really include excitement, engagement, and innovation being the biggest key here. Moving into this class I created at Ohio State called Clinical Anatomy for Undergraduate Students. So some benefits to a course like this, a course called Clinical Anatomy is usually implemented in physical therapy, graduate programs like medical school classes. To the best of our knowledge, there isn't a undergrad institution that has a course like this for undergraduate students, to the best of our knowledge. Some benefits include reaching these students earlier on than professional school. We get to expose them to actual applications of their anatomy foundation. Give them more hands-on experience as well as clinical experiences that they might not be getting elsewhere if they're not shadowing or working in a hospital setting. And then also lastly, present different career options in the healthcare field. So here I really wanted to bridge the gap between the classroom and the clinical realm and just give these students more exposure and more experiences to medicine in different branches of medicine through our use of guest speakers, and also give them more background information and skills so when they do move on to professional school, they have a leg up on their fellow cohorts in professional school. So here I just want to include kind of a list of our full lab activities we do within this course on top of the traditional lectures. So these are kind of split up by regions. So something really I think is cool that I did is I took the first year of medical school, you learn the head to toe exam. It's about 144 skills checklist, and I kind of split up these different skills based off region. So we'd follow up lecture with different lab sessions. So for example, we taught the students how to find reflexes, pulses, do muscle strength testing with the lower limb, the upper limb. But then we took it a step further and introduced things like ultrasound labs that maybe students might not even see till their first or second year of medical school or on rotations. We did suturing labs. And then for each region, I also try to bring in a guest speaker, kind of relative to that region and how they use anatomy within their career. And they also kind of talked on their career a little as well to give students, again, more exposure to different career types within medicine. So we had a abdominal transplant speaker. We had an ENT come in. We did have a guest speaker from the American Medical Association and such. But today I'm really going to focus on these virtual reality and surgery lab sessions. So let's jump into that portion. So I'm going to talk a lot more about the virtual reality lab side of things today as I move forward, but some pros with doing this type of activity as a pre-lab, we can review our relevant anatomy along with spatial relationships. This was a great way to get the students hands-on, get them more engaged, and have more fun with the learning. And then also we can see smaller structures or ones that might have been cut on a donor. We can reset things as many times as we want. But again, I'm going to talk a lot more pros later on with the VR. With our simulated surgery lab sessions, again, we were able to review the anatomy in this hands-on learning manner, keep the students more engaged and have more fun with it. We could really connect anatomical structures with their clinical relevance as we were moving through these surgeries. And lastly, we got another learning opportunity with our donor before cremation. All right, so how this class flow went, we started out with a clinical anatomy lecture where we just lightly introduced the surgical clinical correlate. And then the following class session, usually on Mondays, we did our virtual reality lab session. And then a few days later on Wednesdays, we do our simulated surgical lab session. And we did this 3 times for 3 units over the course of the semester. So this kind of flow went 3 times. So our surgeries by region, in the top row here, you can see our regions that we studied with the VR. Following that second row are our simulated surgeries that were associated with each region. So with the knee region, we did an ACL reconstruction in the donor lab. With our abdomen region, we did a kidney auto transplant. And auto here meaning we just wanted to keep the donor material with the same donor. So we took that kidney and transplanted it down into the same donor's iliac fossa area. And lastly, with the neck region, we did a cricothyrotomy and thyroidectomy procedure. So what did this VR lab look like? In the bottom three images, you can see our students working with the MetaQuest 3 headsets that had the 3D Organon technology on it. And we projected what each student was seeing on each headset to the screen. So at most, we dual projected these visuals, as you can see in that middle image. And I'd say the other half of the time, we kind of just only used one projection to that TV screen while students watched around what the student with the headset was doing. In the upper right image, I just couldn't leave this out. We also use the Sectra table with the students where we use the VH Dissector app. And so we kind of had them half of the time in the VR headset room, the other half of the time they were with the Sectra table. And these were really good to complement each other, where students could start out with that kind of 2D image on the Sectra table, which is like a giant iPad, and then move into the VR headset room where they got to see this 3D human in real time and in real space in front of them. So how this virtual reality lab, how I really wanted to start it out was getting the students acclimated to technology. Technology is weird, it's uncomfy at first. So I posted some VR tutorial images as well as videos to their learning page about a week beforehand so they could get started working with that technology and at least seeing how these remote buttons work and what they're going to be getting into when they walked into the VR lab to actually jump into the anatomy. So while in the VR lab, we had our students work together in smaller groups to fill out guided worksheets. And I'm going to talk about these guided worksheets a little bit moving forward, but it's something I definitely suggest if you're looking to put this technology into your classroom, just to help the students move through things. So just an example of those remote labeled images. Again, these are a little tricky to get down at first. Each joystick moves you either in different planes, zooms in or out, can rotate and spin in different axes. So I just wanted to, again, kind of get the students used to these directions. And I also printed these images out and brought them and put them on the board in the lab so they could kind of scan and over and see these images as they're going if they kind of forget how they work, as well as instructors were available for questions. I just want to play a snippet of a tutorial video. So I actually made these about 5 minutes long for the sector table, 5 minutes long for the headsets. And I kind of would pan from my remote controls of what I was actually doing and where I was moving the joysticks or buttons, and then back to the TV screen of what like was happening as I used these remotes.
Because again, I'm right-handed and I'm going to use the trigger button here to point out a structure and remove it. So you're going to be walking through the worksheet and removing different structures to see deeper structures. So right now, I'm pointing at my prepatellar bursa. We're going to move him out of the way. And now it's just floating in space. And I can always throw it back on if I want to. So using the trigger button, I'm setting it to my right. Now I'm looking at that quadriceps tendon and I'm removing that. I'm removing the patella bone. We're going to set them over there.
And I'm going to show you more of a demo video later, but again, this was more of the tutorial I made for my students. It was about 5 minutes long. So moving back to that guided worksheet, again, I would definitely recommend this. It really depends on what you want, if you want this to be self-study for your students or more directed learning. I chose the directed learning path because we had a small amount of time for a lot of students, so I wanted to help them get through their worksheet and see these structures in a better manner. Sometimes in the donor lab, we give students a list of structures. Okay, find all these, right? What was really helpful with the VR is to start superficial and then move deeper, more internal into the body. So that's how we kind of try to move through our worksheet. So for example, we asked them to find the anterior triangle area of the neck. Can they start moving things out of the way and name them as they go? And our students, again, have taken more of an introductory level anatomy course before this, so they do know that the cartilages and membranes of the larynx are pretty deep in that neck under muscles and some vasculature. So once they kind of got there to that level, can they take these membranes and cartilages and ID them and then put them in order from superior to inferior to really get them practicing through some of these directional terms? With our vasculature, it was also helpful to kind of give guides of where arteries might originate from or what they're giving off next to help them kind of ID these, because some structures we were implementing as new structures, they didn't learn all of these within their intro level anatomy course. And lastly, we'd end each guided worksheet with a kind of thinker type question, get the students thinking, why are we looking at some of these structures? How can we relate it back to those surgeries we were going to perform? For example, what arteries might likely be ligated in a thyroidectomy? Again, get them thinking and also kind of move it and get them transitioning to the thought of the surgery labs that were coming in a few days after this VR lab. So what did our surgery labs look like? Here in this bottom left image, you can see our students working in small groups. So we used prosected donors within this course for the simulated surgery lab sessions, and we had 3. And we had a donor, 1 instructor, and about 6 to 7 students per table. And we had 3 sets of this and actually had to run it 2 times over to accommodate for 40 students within this course. In the middle image, you're seeing our students work through a cricothyrotomy procedure, and we actually bought official cric kits. They were pretty expensive, wouldn't recommend, but super cool for the students to actually perform this procedure on our donor. In the other 2 images, you can see I'm kind of working through a surgical lab presentation, which I'm going to speak on in a second here. So with these simulated surgical labs, I really wanted to walk through this surgical lab procedure before we jumped into the simulated surgery portion on the donors, because again, I mentioned we use prosected donors, meaning these donors have already been dissected in a previous anatomy course. So you can imagine the skin was already taken off. Certain structures might have been cut. So I kind of want to walk them through steps as if they were in the OR room themselves. And then I also wanted to give them more background information on the procedure, types of grafts, things like that, and indications for these types of procedures. So then I'd always end each surgical lab presentation with the specific steps we could perform together today, again, due to these prosected donors. And I also always try to include enough steps that each member of the team could perform one to really build some teamwork and camaraderie among these small groups of students. And then as we walked through our surgical lab steps, we really let the students jump in, and we as instructors guided them and also walked through more anatomy review and surgical landmarks along the way. And I just want to include a few slides. So for example, from our ACL reconstruction surgery lab, we could not cut through the skin. We were using our prosected donors. So talking through that, I made grafts beforehand for these reconstruction labs due to purposes of time and knowing how to suture. So we didn't do this step, but again, I really wanted to show them these steps as if they were in the OR room. But what we did get to do is drill holes through the femur and tibia, and then take that graft, bring it in place, put in screws on each side, and really flex and extend our new ACLs. Okay, so let's jump into my study design. Again, the purpose of this study now was to investigate the effects of using the virtual reality and the simulated surgery procedures on students' confidence and anatomical identification within undergrad population. So I kind of walked you through our red arrows here of our virtual reality and our simulated surgery lab sessions. But if I can direct your attention to our 3 gray boxes, these are our survey series. So we had the students take a pre-VR survey before that virtual reality session. Following the virtual reality session, they took a post-VR survey. And following our simulated surgery session, they took a post-surgery survey. And so throughout all 3 surveys, there were 5 confidence-based questions that were repeated throughout each. And then we asked 5 anatomical identification questions that were mirrored through the 3 surveys, meaning they were around the same topic, but asked in a different way, or maybe a structure that might be deeper. The next question asked about a structure that's superficial to the tag structure. And then lastly, with our post-surgery survey, we asked 5 additional questions about virtual reality involving, was it helpful? Did they enjoy it? Did it help their spatial or their anatomical visualization? So I'll kind of report on all of these today. Okay, so let's jump into the results. And I just want to point out that the results I'm sharing with you today are only including 2 semesters worth of data. I have about 3 semesters to kind of complete as well as go through the data to add to this project. So we're talking about 2 semesters worth of data today. So starting out with our anatomy identification, you can see on our y-axis, we have our mean scores. So these were out of 5 anatomical based questions throughout 3 units that are on our x-axis, the knee, the abdomen, and the neck. So we did find an increase in those mean scores between all 3 units, and we found statistical significance between the pre-VR and the post-VR within the knee and neck unit. So far with our results, we are able to conclude that the virtual reality session boosted the mean scores in anatomical identification for our students. Moving into our confidence, so I had 5 confidence-based questions. Here I'm going to group confidence questions 1 through 4 together because we found the same trend with every single question in every single unit. And I'll explain that in a second here. But really what these questions were highlighting are students confident that they can visualize and identify layers of the region. Can they mentally visualize a 3D map of that region? Do they feel confident that they know locations of muscles, ligaments, arteries, etc. within that region? And lastly, are they confident that they can understand relationships of structures within that region? So I kind of have a key in this upper right-hand corner of those key areas we were asking about through these confidence-based questions. And again, I just want to note here, I'm giving you an example of our knee confidence question 3, but we found this exact same trend throughout questions 1 through 4 for every single unit, the knee, the neck, and the abdomen. So this is just an example, but we found it with all 4 questions through all 3 units. So here we're looking at Likert scale scores on our y-axis, our average of those. And if you're not familiar with the Likert scale, these responses range from strongly disagree to strongly agree. So we scored these from 1 to 5, 5 being strongly agree. So you can see our students really started out about an average of 3 and moved upwards. So they're, at that neither agree nor disagree level. But throughout our pre to post VR to post surgery survey, we did see an increase in the students' confidence reporting. And between our pre-VR and post-VR, we found statistical significance with that increase in confidence level. And then between our pre-VR and post-surgery surveys, we found statistical significance with that increase in confidence level. So again, here we really can conclude that the virtual reality session was boosting the students' confidence levels. Now with our question 5, this was specifically asking if the students felt confident in performing a guided simulated surgical procedure on the knee region in the donor lab. So with this question, I am now showing you knee confidence question 5 as an example, but we did find the same trend throughout all 3 units. So the knee, the abdomen, and the neck, kind of showing this exact same trend. This is just an example. So we have our mean Likert scale scores on the y-axis again. And here we found statistical significance with an increase in those confidence levels between pre-VR and post-VR survey. We found that statistical significance with an increase in confidence level between pre-VR and post-surgery surveys. And lastly, we found significance between that post-VR and post-surgery survey with an increase in those confidence levels. So for at least for question 5, for all 3 units, we can now conclude that the virtual reality and surgery session boosted their confidence levels with this specific question. And I mentioned we had some additional questions that were asked on that post-surgery survey. So I wanted to walk through some results for those. So about 80.1% of students agreed with the statement that the VR lab session made them more confident in their anatomy visualization before heading into the simulated surgery lab. And agreed here is kind of our ranking of 4 to 5. So these students agreed or strongly agreed with these statements. The VR lab session prepared them for simulated surgeries in the donor lab. 89% of students reported they were agreeing with this statement. Moving forward, 93.4% of students reported that they enjoyed the VR lab sessions, which was great to see. 93.4%, funny enough, we got the same percent for this data point as well, of students got a better 3D mental map of the knee. And lastly, 96.1% of students reported that the combination of the VR and the simulated surgery activities made them more confident in their spatial visualization of the region. So a few limitations on my study design. I wanted to start out by, I mentioned these students took introductory level anatomy courses already, and those kind of range. They might have just taken general anatomy, they might have taken dissection-based anatomy, they might have taken biomechanics. So they have more of a higher starting score. As you could see, a lot of those averages started at 3 out of 5, so there wasn't too much room for improvement by the end. We had some variable student participation, and here I wanted to talk about cutting data. So anyone who didn't attend one VR lab session or one surgery session, I had to take out their data from our data sets. If a student didn't complete 1 of 3 of those surveys in that series, I had to remove all of their data points as well. And lastly, students receive completion points just for filling out these surveys, so we can assume that maybe some didn't try as hard as they would have and just kind of put down any answer. And kind of moving forward, we realized, we really could say that the VR was helping students' confidence in their anatomical identification scores, but we realized we're really doing this project in combination. So moving forward, we wanted to tease apart the difference in benefits between the VR and the surgical labs. So we've already kind of started doing this about a semester ago. We're going to take and remove one VR session and one simulated surgery session and kind of alternate these throughout the next 3 semesters to be able to see, is it the VR or is it the surgery lab that's maybe most beneficial? But so far, we can say the VR has been most beneficial. All right, and so some conclusions with my study. These results have showed increased student confidence and an increase in anatomical identification. I recommend to instructors based off my course and these results to take the clinical correlations off the page, make more hands-on activities for your students, bring more of those clinical experiences into your classroom if you can. And these really help promote more learning, higher engagement levels, higher understanding, and really that higher application of anatomy in our clinical concepts. So now that I walked you through my study, some results, I'd love to jump into the technology behind the data and move back into 3D Organon and things I like and some student feedback. So I wanted to start by showing some images. Here with this technology, you can really go system by system, layer by layer, which I love. And so I have the headsets on in these images, and I was having a friend or myself take some photos. So here we're jumping from having the whole skin layer on, taking the whole skin layer off, and we're seeing all of the musculoskeletal system. The bones are underneath. We're seeing a little bit of the nerves popping out. And then we took the entire musculoskeletal system off, and now we're seeing that skeletal system underneath with our thorax organs, our abdomen organs, some of our head and neck organs intact. And then I removed all of that vasculature. I took off nerves, arteries, our lymphatic system, and now we're seeing again skeletal system with those organs internal and underneath. And then I took skeletal system off. So now what you're seeing is more of our oral cavity, mucosa and organs. You're seeing our thorax organs, the heart and lungs. And then you're seeing our GI tract organs or our gastrointestinal system. And then lastly, I wanted to say, okay, let's say we took that lung and we went to our microscopic function. We just jumped inside of a lung, and now you're looking at an image of an alveoli and terminal bronchiole, which is something you're used to probably seeing on a histology slide, but now we're seeing it in 3D space with color, which is really awesome. And I'll talk about that microscopic page in a little bit. Some other capabilities here. So you always have this side screen where I was able to remove different systems at once or add them in. With the muscles, you can add kind of a thin layer muscles and then higher up and more superficial as you go. Let's say, for example, we're looking at our pectoralis major muscle, our push-up muscle. So I have my remotes kind of pointed at it, which will show the label at that point, and it also highlights that muscle. And then if I click on that button and move it, I can take it off. And then I'll direct my attention to my right side small subscreen. And there I have tons of functions. I could do things like hide that muscle. I can fade it so it'll get like a thinner color. I can go to my definition button and I can get my origin, my insertion, my actions of that muscle. I can get the innervation and the specific blood supply to that muscle. And you can do that for every single muscle. On this small side screen, you can also click on the clinical option. So this will give you clinical disorders or disease types that have to do with the certain system you're on. So since I was on the musculoskeletal system, you're seeing some of those disorders here. And then lastly, this was that microscopic screen. So I showed you the alveoli and the lungs. You could take some of the GI tract and see some of the folds inside the GI tract, different cells. Again, things you might be used to looking at on histology slides, but now shown in color and blown up in 3D space in front of you, which is really cool. And I just thought I'd give kind of a quick 1-minute video demo so you can see this in action versus just stagnant images. Me just kind of being dramatic with remotes there. We're panning into the TV, so now you're seeing what I was seeing on my headsets. And so there, I just took off the muscular system so I could see just the bones and internal organs like I showed you in images. And then I'm going to throw the muscle system back on. And now I'm pretending like I'm in my unit 1 where we're going to examine the knee region in class. So I'm going to pull that 3D donor up in front of me. I'm going to zoom into that knee region, make that really big, which is something great you can't do in the donor lab. You can't expand images like you can here. And so I'm going to kind of go one by one, superficial to deep, so outer to inner, take some of these structures off and just move them wherever I want. You can put them wherever you'd like. And as you grab them, it's giving you your label too. Okay. What you can do is you can spin the donor in front of you. You can also just walk to the side or to the back side, wherever you'd like to be. So now I move to a little bit more anterior and lateral surface as I take some of our quadriceps muscles off. And then if you want to put something back in place, you just kind of take that muscle, throw it back in its general area, and it should mold back into place. Okay, I put a few structures back now. Now I'm like, I have too much going on here. I'm going to look at my sidebar and click reset. So I can put it all back together at once, and it'll kind of zoom back down into normal size in front of you. So you can restart. Okay. So some more pros, I kind of talked on everything is labeled. I just think that's great versus traditional, let's say donor studying with a friend. You're in the lab learning anatomy for the first time. I have students report their biggest issue with being in the lab is when there's no instructors to kind of correct them if they're wrong or help them find a structure that they're just struggling on. But with this technology, you have every single label in front of you. I talked about how you can see smaller structures and zoom in, and you can really enlarge these regions in front of you versus traditional donor learning where, things are small and that's how they are, and you're going to compare to textbook images as you're studying. You can go system by system, as I said, and you can really go structure by structure. And lastly, that microscopic function I talked on, again, there's like a whole sidebar of all these different structures you can look at. But what also you can do, which is really cool, you can kind of just, as you're wearing the headset, walk into the 3D human. And as you walk into a certain area, let's say the lungs, you can see inside the lungs and see those alveoli. You can walk into your large intestine and see the folds inside there. You can walk into the stomach. So that's just a really cool capability. And honestly, there's so many more capabilities and functions with this technology that you can use that I haven't even tapped into. There's imaging, ultrasound, dental anatomy. I just haven't had the time. I've been focusing more on my course and what I wanted to use it for, but there's so many different things you can do. Some other things that I really like about this technology is the way you can rotate the 3D human. So you can, if you look to the right upper part of the screen, these different axes, so you can turn the person in the longitudinal axis and you can spin in the frontal or transverse axis. And this is, again, comparing to traditional donor learning. When you're in the lab and you're looking at your donor with your friends, right, and you're studying, you're looking at the pec major, so on the anterior surface. If you need to flip the donor over, you would have to do that to see the posterior muscles. So with this technology, you can just spin it really easily. Next, this is really a space saver. So if you're able to have a TV screen where you can project or cast what the student is seeing on the headset, this really allows for larger student learning groups. So you can have, let's say, 10 students watching the TV as one student wears the headset. Versus traditional donor learning, there's only so many students you can fit around a donor table, as well as how much can they actually see these small structures you're looking at. But here you can blow things up onto a TV and have bigger groups learning from the person wearing the headset. And this technology really allows for students self-study. So if this is something you just want as an optional resource for your students, they can go in on their own time. And again, comparing that to the donor lab, they have all the labels in front of them. They have additional things like clinical facts, their actions, origins, insertions, things like that. And lastly, this technology really allows for collaborative learning, which I just wanted to touch on for a second. So collaborative learning in a nutshell is when students work together in small groups to work through concepts, to solve problems. Some core characteristics of this type of learning is shared goals, active participation, and especially educator as facilitator, meaning the educator, instead of giving a traditional lecture, is now more of a facilitator. They're there to guide or answer questions, but they're not fully facilitating this entire session like a lecture-based component. So with the VR, one student is our driver, and the rest of our students in the group are our guiding passengers. So we give them something like a guided worksheet or a lesson plan. They can really walk through those structures with their fellow classmate wearing the headset. They're able to help identify anatomy structures, but it really gets them practicing their spatial visualization in their anatomical terminology. Can they tell their fellow classmate with the headsets, okay, you want to look more superior? Oh, it might be a little deeper to that bone. Keep looking, things like that. And then lastly, with this collaborative learning, we can really use this technology into large enrollment courses. Do you have 40 students like I did and you want smaller groups, or do you have a 200 size class for medical school? but you can really fit more students into these type of labs with this technology. So what are the students saying? Let's talk about it. Here are some quotes I've pulled from different evaluations and course feedback surveys. So the students reported that they enjoyed the VR. It helped them picture anatomy in a 3D perspective, and they liked seeing how it connected in our own bodies. They really liked the VR because they used it to better visualize the muscles, nerves, different structures. They feel like they remember the most from the VR session. They said the VR was very informative and helped them understand spatial arrangements and relationships for the knee joint. They enjoyed the VR. It was a cool way to study. They liked that they could freely manipulate the joints and ligaments to see everything. And lastly, my favorite part of the VR my favorite part of this course was the VR labs. It allowed for practical application of their material they learned, and it really helped them on their quizzes because they could visualize what they learned in lectures and apply that knowledge. What about the bad feedback? I'd say this is the most bad feedback. Sorry, my screen's freezing. This is the most bad feedback I've received, or negative feedback. The students really wanted more time to work with the technology. We gave them about 30 minutes times 3 sessions over the semester, and they just reported they wanted more. I have a lot of them coming to me asking how they can reserve the VR rooms and work with the technology more. So some other student populations that I've used the VR with include physical therapy and occupational therapy students. Last summer, I decided to do some optional office hours just so they could see some structures within VR that maybe were hard to see in the dissection lab. And then lastly, I've used VR with high school camps. So we use VR with our MD camp here at Ohio State, as well as our neuroscience camp. So with our MD camp that we do every summer, VR is used the past few years. And then this year I actually implemented my ACL reconstruction surgery lab with these high school students, and they really enjoyed both of those sessions. And then with our neuroscience camp held at Ohio State through the Department of Neuroscience, I've taught this the last 2 or 3 years, where we're teaching neuroanatomy specifically with the VR technology and the 3D Organon. So you can see some of those students here working through the parts of the brain underneath the skull. So some challenges I've faced as I've gone through this project over the last year and a half. Number one, tech can be intimidating, a little uncomfy, and some time consuming for the students to learn. So what I'd recommend and wish I did myself is to kind of incorporate enough time that you can have a full just VR training session in the beginning of your semester before you're doing your actual anatomy VR labs. This would allow them to get that technology down. So when you get into the actual anatomy learning, you can move through it quicker and more seamless. But, that brings up the issue. How do you get students to come to this optional training lab, right? Maybe you can give some attendance points if your course syllabus allows. Maybe you can give a quiz that's built into their class points, a quiz on, how does the VR buttons work, things like that. So to kind of get more encouragement and participation at those VR training sessions. Virtual reality can be a little time consuming for the instructor, but I really recommend this will strengthen your teaching practices and really raises the bar for you yourself as an instructor, but also your university. You're raising the bar. Lastly, I would recommend having some trial and error with your instructors trying out the technology. So I kind of made some of my guided worksheets before I even went into the VR lab to kind of investigate, does it have all these structures? And it was a few far between of a few structures I was missing that I wanted to include on my guided worksheet that I ended up having to cut out because I couldn't find them on the technology. Lastly, my one small complaint is just that you can't adjust the 3D visual like you could do in a donor lab, right? So if you're imagining our brachial plexus in that axilla or armpit area, it's really helpful in the donor lab to extend the arm, or if you're looking in the neck, you can tilt the head back. But on this technology, these are more stagnant 3D images that you can spin and move around, but you just can't, let's say, adjust a limb. And lastly, we have some students who might get potential VR sickness. So this includes more motion sickness, headaches from wearing the headsets. So I would just recommend, having some type of additional resource for them, maybe make a PowerPoint, with 2D images, but just something to supplement the VR learning that they're missing out on. I've only encountered this a few times over 4 semesters at this point, but just something to be aware of with the headsets. And some considerations and practical advice if you as an instructor want to implement this in your classroom. So just some questions to get you thinking, how many students are in your course? I had 40 students. Do you have 200 medical students? Really kind of think about your class size, how you can break these class sizes down or keep bigger groups, whatever you'd like to do. What type of student population do you have? Again, I was using this with an undergrad, but if I was using the VR with a physical therapy group, I'd probably just focus in on bones, the skeletal system, and the musculoskeletal system. Or do you have medical students? Do you have nursing students? How much time do you have to incorporate these labs, and how many VR sessions do you want to have? I used 3 VR sessions for an hour and a half each, but I broke down students into small groups into 30-minute blocks. Again, it's kind of up to you and what you're thinking about doing with these sessions and what you want the students to get out of them. What resources do you have? And resources in the sense that, do you have one headset, one MetaQuest headset to use the 3D Organon technology? Do you have 10? Do you have one TV? Do you have 10 TVs? Can you cast only one headset, or can you cast multiple to that TV? Things like that. How many instructors do you have available? So do you have instructors available to run these VR sessions with the students? Do you have maybe a tech-specific instructor who can be there to help with logistic issues or technology problems? Sometimes the technology might lag or something turns off. Do you have someone who can help with those? Or do you have someone who could dual teach the anatomy questions as well as tech questions? Do you want this to be more structured learning for your students? So I use those guided worksheets to help move through the anatomy quicker because I had smaller amounts of time. Or do you want this to be self-directed? Do you want this to be for students to be able to go into the VR lab whenever they want on their own time? Maybe make them modules or lesson plans so they can kind of walk through these structures without an instructor being available, and maybe give some clues or guided direction of, you're going superficial to deep to find these things. And really, lastly, it's all about, what is your goal as the instructor? Do you want to complement VR to traditional donor learning, or are you using VR standalone and you don't have access to donors? Do you want to use the VR for office hours, again, as an additional resource? Do you want to pair the VR with other lab activities? I paired the VR with simulated surgeries as a pre-lab. You could also do VR as a post-lab after dissection-based learning. So it's really all about what you're thinking of doing, but just some questions to get you thinking of how you can use this technology in your own classroom. So what's next for me? With my current project, I love eventually to expand it to more regions of the body and more systems. Next up in the next year, I'm going to graduate and start a faculty position. So I'd love to implement this technology into more courses and also into other student populations. So in grad health professions, I'd love to put it into PT, nursing, med, if it's not already in these courses wherever I end up at. I'd love to do my own standalone VR research project, kind of cut out the simulated surgeries and just focus on the outcomes and student confidence with just VR alone. I'd love to tap into the other capabilities of this software. As I said, there's imaging, ultrasound, dental anatomy. I just would love to explore those options and see what I can do with them in my students' learning. I just haven't had time yet. Wherever I end up working at, if there are no donors at that institution, I love to jump into the assessment functions. So you can do quizzes, maybe you can do practical exams on the VR only if you don't have access to donors. And lastly, just moving forward, I love to collaborate with physicians and surgical educators and work with residents and really help the residents train with this VR technology in different ways. And in closing, I'd recommend 3D Organon to instructors of all levels, especially as a complement to traditional donor learning. And I just had a quick special thanks to give to our human donors for all of the learning everyone in anatomy is given, and to our EdTech Incubator and Health Sciences Library, where we have these VR resources at Ohio State. This project wouldn't be possible without them. To Mo Duncan, who is our EdTech coordinator and has helped me with all my tech issues or problems over the last year and a half. And then Alice Henry, Catherine Dugan, Wendy Pramick from Ohio State's Marketing and Photography, and my PhD advisors, Dr. Chris Stover and Dr. Claudia Mosley. They've been amazing and helped me along the way. And lastly, Dina Masad, who's a master's student at Ohio State, who helped me kind of organize some of this data before the AAA conference, and she's been great. And with that, I'll take any questions or comments. I threw up my email here as well as my LinkedIn code you can scan if you'd like to reach out with any questions after this talk or collaborate in the future. And thank you guys for having me again.
Thank you so much, Jenna. That was an amazing presentation. We can now move into the Q&A portion of the session. So if you have any questions, please feel free to type them into the chat. But just before we begin with this, I would like to add something about the static image that you mentioned. What we include in the platform is the body actions, which allow you to review the whole range of that action. So it's pretty easy to even stop at the range that you want to visualize. And it's very interesting in comparison to just having the simple image up there. So thank you for pointing that out. And I can move on with some of the questions that we already have. So how can VR-based pre-lab training be integrated with real surgical decision-making to improve learning outcomes?
I feel like that's a loaded question. I definitely like previewed one of your webinars where I saw a surgeon actually bring the VR headset into the surgical lab room on the OR table. I will say maybe that's a little bit more out of my scope to answer this, as I like am getting my PhD in anatomy and don't have that full medical training. But I'd love to kind of look into that more and maybe get back to you.
Great, thank you. Do you students use the VR for personal study or peer practice outside of class time, or do they always need an instructor at your institution?
So at least within my course, I've implemented those, multiple sessions throughout the course where they use it. I've had students come to me afterwards and say, I want more time with the technology. How can I get in here? And so basically at our institution, if you work with our ed tech coordinator, she gives you like an hour training. She just kind of has to make sure she trained you. After she trains you, then you're able to reserve the VR room and go in and study on your own time if you'd like.
Great. Here's another one. Hi, Jenna. Amazing presentation. This is a comment by Mary. In your experience with 3D Organon, how long does it typically take to move from pilot testing to full integration across an entire program or cohort?
So I implemented this for the first time in 2024 for just one VR session. And me as an instructor, as well as my students, that was kind of all of our training. And then by spring, I did 1 hour training with Mo, our EdTech incubator coordinator, and then I implemented in the spring, and that started this project. So I felt like it was a little weird at first, getting used to, but like jumped into it right away. I'd say it took like an hour to kind of get the remote and just everything, all the functions down. So I thought it was a pretty quick transition. And I've also
Great,
then myself trained fellow instructors in the VR, and again, pretty quick, even with my older colleagues.
great. So what is the biggest limitation of VR pre-lab training that still prevents it from accurately reflecting real surgical complexity?
Um, let's say, for example, being able to take the systems off at once is great, but like if you're cutting into someone's knee, right, you're cutting into a small area, not removing the entire skin layer at first, or like if you're cutting into a certain ligament or just making a small surgical window, you wouldn't take the entire structure out, let's say, how you would in VR. I would say that.
Okay. And we have some in the chat as well. Thank you for a very interesting presentation. I'm John from Abuja University School of Medicine in Philippines. Based on your experience, what would be your logistic recommendations for effectively teaching virtual reality lab for medicine students made up of at least 142 per class with only an hour, 1 day lab class per week, for
1 hour
example?
a week. If I could, like just off the top of my head, I'd take those 140 students, split them up into groups of 70. Again, I think it kind of depends on how much resource you have in, let's say, headsets and TVs. But if I could, I'd do 70 1 week for that hour, the next week do another 70 and kind of flip flop each week. And then maybe from there, if I had, let's say, 7 headsets or even 4, I could do small groups of 10 to 15 of those students with one person wearing the headset, and you have a whole hour. So have one person put it on for 10 minutes. You could get at least 6 through that using the virtual reality, while the rest of those small group students are kind of viewing what they're seeing. I'd also really make a game plan of a guided worksheet or some kind of lesson plan to move them through it quicker. I'd also, if you could, just start out the entire semester with like a 1 hour VR training session. So when they come in for the actual anatomy, they're moving through it instead of learning how to, work the buttons.
Great. So there's a mention in the same comment that they have 10 VR units, but they could borrow additional 15 VR units and 3 monitors.
Oh, amazing.
So I think there's
So 25 total
yeah,
with
that could be up to
140 students.
25. Yeah.
what is that off the top of my head, like 5 students per headset at that point. I think
That
that'd
would
be
be amazing.
amazing.
Yeah.
We worked with about 7 students per headset. So I
Oh,
think you
that's
could do
great.
that
Yeah.
easily. Yeah. And we again use for 7 students about 15 to 30 minutes with just the headset. So if you have a whole hour, I think this would be great for them.
Great. So how many VR headsets do you have? Did you have a tech-specific instructor at hand during the practical, or did you as a teacher solve technical issues as well?
Okay, starting out with the headsets, we had probably at least 8. I could be wrong, but with only 6 to 7 students using it at once, I just decided to keep one headset, the rest of the students viewing what they saw on the TV. I did try that dual casting where I had 2 headsets projected and the screen was split in half. It just made things smaller and also just kind of overstimulating for the students trying to watch their side screen and then the other, and they're like, who am I looking at again? So I kept it about 7 students to one screen. Could you repeat that second question for me?
Yes, of course. Did you have a tech-specific instructor at hand during the practical, or did you solve the technical issues as well?
So at first, like that first semester I started working with the technology, she was definitely always there because I was a little stressed myself. And then after that first semester, it was always just me and my fellow instructors that I trained in the VR, and we were able to solve these things on our own.
Perfect. So there's another one. Do you have an instruction or advice to connect the device to the TV screen? So the PCVR, I guess, and how you have implemented it into your classes.
Sorry, do I have what connected to the TV screen?
Uh, the devices, the VR devices that are connected to a screen. So the PC VR mode
Like,
that you have. Yeah.
yeah, the headset is
Yeah.
connected to the screen through like the casting mode through the
Yeah.
class
So
headset.
there's a question if you have any instructions or advice on how this works and how to connect the
Oh,
devices. But
it's
that's a question we can also
Yeah, if you can
uh
answer it, great. From what I've seen, we pull up Google Chrome and then have casting
mhm,
mode on, and then on the buttons, we go to the kind of home screen to the camera, and then you just click cast to web,
yeah.
and then it just shows right up on the screen.
No, we have extensive user manuals for every type of license that we provide. So that is something that we also give with you as complementary with the devices and the licenses as well. So how to connect and how would you compare this to other technologies for anatomy education?
Yeah. So I think I've used like comparative anatomy or not comparative net anatomy. I've used that on, the desktop. I've used the VH dissector on the sector table. 3D Organon's like my favorite for sure. I was just blown away when I first used it. And I was just kind of, it gave me all these ideas like, what else can I do with this? And like I said, there's so much more I want to do. I just don't have the time right now in my PhD, but I think it's the best thing I've ever used.
Great, thank you for that. Um, we move to the next one. Kyle says, thank you for this awesome presentation. I'm a technologist at my university and would love to learn more about how I can support our faculty and projects. With that in mind, how did the EdTech team help set up you with success? Was there a planning stage, resources offered, etc.?
So I'd say like I met with our EdTech coordinator. I did my hour training really to get the capability to be able to reserve the VR rooms. And then from there, again, she was there to answer my questions. She was great. But like when I planned this whole project, it was kind of just me talking to my advisors a little bit too. But like people outside of technology, we planned all this. I asked a few additional questions. She's like, how many headsets can we use at once? But I'd say like it was really easy as an anatomy instructor to understand and figure out how to use it.
Great. So we have another question from Angela. Thank you for the rich presentation. Are these resources, platforms, technologies currently available to educators outside the US, Europe to be exact? In 2026, how would you advise a recent graduate to follow your path? What should they aim to study, master? What do you think would be a waste of time? So for the first part, and sorry to interrupt you, we have a global presence, and what we do is we offer support to all countries. So there is no matter of convenience, and we can support you anywhere across um, the globe.
And can
So
you
you
repeat
can,
that second question? I'm
yeah, of
sorry.
course. How would you advise a recent graduate to follow your path? What should they aim to study, master? What do you think would be a waste of time?
I think starting out like with recent graduate is just like really getting your anatomy down. So when you get onto this technology, like you already know where everything is. Yes, there's the labels. I think just spending some time with it, honestly, just playing around with the technology, almost like a video game, and just getting yourself comfortable with it. So when it comes time to work with your students, you don't look like you know what you don't look like you don't know what you're doing. Also just playing around with it brought up little issues, but barely any issues, or, oh, like this might die. You need to make sure to put a battery pack on, different things like that. I think just as I've worked through this through multiple semesters, each semester I've gotten better, even though I didn't think I could kind of thing. Again, like kind of started using VR in undergrad anatomy at Ohio State, which we didn't do. I know it was used with med students for sure. I think it was awesome to kind of start that out and then also talk to other instructors. Here's how you can implement it. It helps with my students. I hope that answered your question.
Thank you so much. Moving on to the next one. Thank you for your useful session. I want to know whether it is possible to use this technology instead of dissection in future.
So I think so, but I always go back as myself, a traditional anatomy instructor, that like nothing can replace donor learning and dissection-based learning.
Exactly. Yeah.
But I do think if your institution doesn't have donors and you don't have those donor resources, like this would be awesome to do practical exams on as well as study off of, versus I know you can do printed out images, things like that. But I'd recommend this if you had no donors. If you do have donors, I definitely think it's a great complement, especially being able to, like I said, zoom into things and things you just can't do in the donor lab. Like this in combo with donor learning, I think is like what should be our future.
Great. And some practical questions. How do students have access to the worksheet while they're in VR? Do they look at it with pass-through, or do their teammates help them by feeding them the questions?
Yeah, so I put the guided worksheets on their learning page ahead of time so they have access to it on their iPad on their own devices. I also print one out for every student there. And so then when they come in, we give them the worksheets. Usually the person putting on the headset will drop their worksheet. Everyone else around them will hold theirs, take notes if they need, kind of start reading through, hey, you're looking through like the cartilages of the larynx. Can you take all the muscles off? We got to see deeper. Kind of have them guide each other. I was there for anatomy questions for tech issues, but I also would jump in if I felt like they kind of didn't know where to go next or they were struggling. Sometimes, like, I would get a group of students who didn't feel like putting on the headset. So I'd jump on the headset and give them a whole virtual tour and say, okay, wait, can you walk me through the worksheet like you would have done with a classmate? Okay, what are we looking for next? Again, to really get them practicing without me kind of taking over the instruction.
Perfect. And again, thank you for your nice presentation. How did you measure the confidence level of your students in identifying various anatomical structures in your research pre and post VR? What do you recommend for users who show headsets and other symptoms related to using VR headsets? So headaches
Yeah,
and other symptoms, so nausea and stuff
Yeah, to
like
the
that.
first part of that question, so we like kind of separated anatomical identification questions from those confidence questions. So the confidence questions were really related to how do they feel? Do they feel confident in their visualization? More general terms, do they feel confident in knowing a 3D mental map of that area? With the anatomical identification questions, I had some of those be straight written text questions like, what is the vein that sits outside or external to the sternocleidomastoid muscle? Or I use image-based questions like kind of pointing with an arrow at the sternocleidomastoid muscle. Do you know what vein sits deep to this muscle? Again, kind of using some of those spatial terms too. We were trying to get them to practice. So those were kind of separated. Moving forward, I guess if you were to implement surveys, I'd recommend a confidence component, the anatomical identification component. I'd also recommend higher numbers of those questions. Because I did this 3 times over, students were taking 9 surveys within my class, which is just kind of a lot for them to do. But if you can have less surveys or less regions, let's say, I just up those number of questions instead of 5 questions. I think that could be way higher, 15 or 20 per section. And then, sorry, the second question was about like how to help with that.
Symptoms of VR usage, so headaches, nausea.
Yeah. So
How would
like
you
I said,
recommend using? Yeah.
I haven't really experienced this too much. I'd say I've had about 2 or 3 students who came in and said, I get motion sickness, I have vertigo, I'm not putting on the headset. Like, can you give me something else to do? And I was like, of course we can do that. Like, do you even want to try? And they're like, nope. And then as far as students actually having these symptoms, I've had a few kind of take off the headset after wearing it for 10 to 15 minutes and they're like, my head really hurts. I'm like, all right, like just sit down for a second. Like that usually happens to me too. We're just not used to wearing these things all the time. So that's how I've handled it so far. I just haven't had too many issues with that.
Great. And just to answer a question from Maria, the seminar has been recorded and it will be uploaded into our YouTube channel, so you can find that later in our channel as well. And what are the advantages of using VR? Oh, sorry, that one here. Okay. What are the advantages of using VR over the normal version of 3D Organon, maybe even with a large touchscreen?
So correct me if I'm wrong, the normal version is on a desktop, right? So like
It's
a
either
computer screen.
desktop or mobile devices, tablets,
Yeah,
touchscreens. Yes,
I'd say
any
like
non-VR device.
yeah, to me, I haven't really worked with like the normal system, but like to me, having like this 3D human in front of you and being able to walk around it, like it is in this real space in front of you, being able to spin it is just so different to me than looking at things on a, desktop or a laptop screen. I feel like even on that desktop laptop screen is really, it is 3D, but it's still 2D, if that makes sense. And just having it in front of you, like I said, you can actually wear your headsets and walk through structures and you'll literally get inside of organs. I just think that really helps with those spatial visualization, and kind of like because something I wanted from my students was like getting more of this 3D mental map of the body versus memorization. Like I'm tired of the memorization. I want them, can they understand it? Can they really picture these things? And I think the 3D or the VR 3D Organon really helps with being able to visualize everything together in this space so they can practice that on their future patients in front of them.
Great. Jenna, thank you again for your time and for sharing your insights with us today. We really appreciate your work and look forward to what comes next. Our team is always happy to support you. And thank you to everyone who joined us today. We're glad to be part of this session. The webinar recording, as I mentioned before, will be available soon on our YouTube channel, and certificates of attendance will be shared shortly after the event. Be sure to follow us on social media and stay tuned for upcoming events, news, and updates. So our team has been working on making 3D Organon more accessible and easier for use for both educators and students. So a new 3D Organon web platform is now available, and we're really excited to showcase it to you. Thank you all once again. You can contact us at our email prosupport@3dorganon.com, and we look forward to seeing you at our next webinar. Thank you so much.